Looking back at Jordyn as an infant, I would say she was more of a sickly child than a healthy child. She ended up with colic, and then ended up with acid reflux, so she was on medicine for that. And she had tubes in her ears at 8 months old. She was only 12 pounds. She ended up with a feeding disorder, but overcame that. We never really thought any of that had to do with her heart, but I think a lot of her symptoms were because of her congenital heart disease. I enrolled Jordyn in gymnastics when she was about 4.5 years old. After a couple classes, the coaches had, I guess, seen her strengths and her skills and moved her up right away to an invitational only class. And she was fine during all that time before finding out her symptoms.
I always got really tired in my floor routines, and then one day in school I was just sitting there and my heart started palpitating really hard.
I got the call from the school. It was in February of 2012. The nurse had called and said, Jordyn is here. She felt like her heart was pounding out of her chest in class. Went and picked her up from school, brought her home, and she couldn't control. She felt like her heart was, racing so fast, and she was scared, so I called an ambulance. And they did test after test, chest x-ray. They said her heart was fine. So we left the hospital, and I told her nurse, and her nurse said, I don't buy it, that it's just anxiety. So I did call her pediatrician, and her pediatrician recommended that she go to University of Maryland Children's Hospital. 2 days later, they had called and said she would need open heart surgery, no more sports, nothing. I was thinking, she's gonna be devastated.
I was scared they were gonna make me stop doing gymnastics.
Her pediatrician had heard a murmur or an abnormal heart sound. At that time he did an echocardiogram and noticed that there was a defect in the wall between the two top chambers, or atrial septal defect. He did some more investigation with a cardiac MRI and found that there was something called a sinus venosus defect, which is a hole in the wall between the two top chambers of the heart. There also, with the kind of defect, is associated an abnormal pulmonary vein, which is a vein that drains the lungs, which was coming back to the wrong side of the heart.
Right before they had put her under, the anesthesiologist came and talked to us and explained it very well, exactly what she was going to do. And she asked Jordyn if she was nervous. She could tell Jordyn was really nervous. So they did what they had to do with her to calm her down a little bit. And then once you see Jordyn calm down a little bit, then we felt a little better about it.
She's a high-performing athlete who's just been told, your heart, the thing that, sends blood to all these fabulous muscles that you have, to your mind, to all these important parts of you that you can make do wonderful things. Your heart, the very most core part of your being, is, damaged or needs repair.
It was almost like one of the family members was there with us. She had taken that much interest in Jordyn.
I think Dr. Savarese told me to imagine my floor routine so that I wouldn't be as nervous for my surgery, and I would just think about doing something that I like to do.
I said, we're going to just work together. So you're going to close your eyes. You're going to imagine yourself now you're stepping onto the floor, and you're going to take your first breath, and now we're going to just imagine your first tumbling run. And while we were doing that, I was putting her IV in, taping it in place.
The surgery for her involved a few steps because of the multiple problems.
Before my surgery, I always had really bad chest pains and shortness of breath, and I was always dizzy. And then after my surgery, it was the complete opposite. I wasn't dizzy, I didn't have any more chest pain, and I didn't have any more shortness of breath in my gymnastics floor routines, and everything was just better.
The doctors at University of Maryland, they were always there.
The goal of our division and of the Department of Pediatrics as a whole is to provide good care to families and patients. And part of that is talking to families in a way that they can understand what's going on, being reassuring, being supportive, and not just telling them this is the diagnosis and what we're going to do and walking out of the room.
It made me feel very comfortable because not only I had questions and Jordyn had questions, and they even said, have Jordyn write a list of questions, concerns, when she meets with us, and she did.
I think that one of the things we really strive to do is to be family-centered. The other thing that we try to do is to approach things as a team. I wasn't the person who diagnosed Jordyn, but I've been able to take care of her since then. And I was certainly only one of many people that was involved in her surgery and the rest of her care. And we all try to work together and do that pretty well and to give patients the best care that we can.
Well, the year I came back from my surgery, I made it to level 8, which was my goal. And then that year I made it to regionals, and I also got nominated the Gymnast of the Year.
Her quality of life has improved 100%. She's got a fixed heart, which made everything better.